Ever wondered why your feline friend suddenly started behaving differently or showing signs of discomfort while urinating? It could be a sign of something more serious, like a urinary tract infection. Recognizing the symptoms and understanding the treatment options is key to your cat's health and well-being. Urinary tract infections, or UTIs, are surprisingly common in cats. They can cause discomfort, pain, and even serious health risks if left untreated. One of the most telling signs of a UTI in cats is frequent urination. Your feline friend might be making more trips to the litter box than usual. And sometimes, despite their best efforts, they might have accidents outside the box. This isn't them being naughty, it's a cry for help. In addition to frequent urination, you might also notice blood in your cat's urine. While it can be alarming, it's another telltale sign of a UTI. The urine might also have a stronger smell than usual, and your cat might even seem to be straining while urinating. Discomfort is another key symptom to watch for. Your cat may seem more restless than usual, or they may be over-grooming, particularly around the belly and genital area. They might also become more reclusive, hiding away because they don't feel well. It's important to remember that every cat is different, and symptoms can vary. But if your cat is showing any of these signs, it's a good idea to seek veterinary advice as soon as possible. Understanding these symptoms allows you to act promptly and effectively. So you've identified the symptoms. What's your immediate course of action? The first response should always be to consult a veterinarian. While you may be tempted to go down the Google rabbit hole, nothing beats the expert advice of a vet who can provide a precise diagnosis and treatment plan. Your vet will likely conduct a series of tests to rule out other conditions and confirm a urinary tract infection. This may include a physical examination, urinalysis, or even ultrasound. Remember, each cat is different, and what works for one may not necessarily work for another. This is why professional advice is indispensable. It's tailored to your cat's specific need. But what can you do while waiting for the vet's appointment? Your role in this period is to provide the utmost comfort to your feline friend. It's important to remember that your cat is likely in discomfort, and your support can make a world of difference. Keep your cat hydrated. Encourage water intake by providing a fresh and clean water source. Some cats prefer running water, so a cat water fountain might be a worthwhile investment. Hydration can help flush out the bacteria causing the infection. Ensure your cat has easy access to a clean litter box. Cats with UTIs tend to urinate more frequently, and a clean environment helps to prevent further infection. Try to minimize stress. Yes, cats can get stressed too. Maintain a calm environment, stick to your cat's routine, and provide plenty of gentle affection. Lastly, monitor your cat's behavior closely. Note any changes in eating habits, litter box use, or general demeanor. These observations can be helpful for the vet to fine-tune the treatment plan. Your cat's health is in your hands. Be proactive, be observant, and most importantly, be there for your cat. Your actions in these initial stages can significantly impact the course of your cat's recovery. The vet will likely perform a series of tests to confirm the presence of a UTI. This may include a urinalysis, which checks for the presence of bacteria, crystals, and blood cells in the urine. They might also conduct a urine culture to identify the type of bacteria causing the infection. In some cases, the vet may recommend an ultrasound or an X-ray to check for any abnormalities in the urinary tract that could be causing recurrent infections. Once the diagnosis is confirmed, the vet will prescribe a course of antibiotics to kill the bacteria causing the infection. The length of treatment can vary from 1 to 3 weeks depending on the severity of the infection. It's crucial to administer all the prescribed medication, even if your cat seems to be feeling better. Stopping medication prematurely can lead to a recurrence of the infection and potentially breed antibiotic-resistant bacteria. In addition to antibiotics, the vet may recommend dietary changes to help reduce the likelihood of recurring infections. This could involve switching to a wet food diet, which can help increase your cat's water intake and flush out the urinary system. They might also suggest a special therapeutic diet designed to maintain the health of the urinary tract. Remember, your vet is not just there to prescribe medication. They're also a valuable source of advice and guidance on how to care for your cat during its recovery. They can provide tips on encouraging your cat to drink more water, managing any discomfort, and spotting signs of potential complications. In all of this, it's important to remember that your vet is your ally. They're there to help you navigate this challenging time. First things first, hydration is key. Cats with urinary tract infections need plenty of water to help flush out the bacteria. Make sure your cat has access to fresh, clean water at all times. Some cats may even prefer running water, so a cat water fountain could be a good investment. Now, on to diet. Your vet might recommend a special diet to help manage your cat's urinary health. This could be a wet food diet, which not only provides the necessary nutrients, but also additional moisture to aid in hydration. Some diets are specifically formulated to aid in the dissolution of urinary crystals, if that's a concern. Stick to the diet plan your vet provides. It's designed to help your cat heal and prevent future UTI flare-ups. Another key component of home care is medication. If your vet has prescribed antibiotics, it's crucial that your cat completes the entire course, even if they seem to be feeling better. Stopping medication prematurely can lead to a recurrence of the infection. Administering medication can be a challenge, but patience and persistence are your allies here. Monitor your cat's litter box habits. If you notice that your cat is still straining to urinate or is making frequent trips to the litter box, it's time to consult your vet again. Don't forget to keep the litter box clean and easily accessible to encourage use. And let's not forget, comfort and care go a long way in recovery. Spend quality time with your feline friend, provide a comfortable resting area, and keep stress levels down. A calm and comfortable cat is more likely to recover faster. In essence, home care for a kitty recovering from a UTI involves providing clean water, a proper diet, ensuring the cat takes its medication, and offering comfort and care. It might seem overwhelming at first, but remember, you're not alone in this. Your vet is there to guide you, and your love and care are the best medicines for your furry friend. Proper home care is crucial for your cat's quick recovery. So let's ensure our feline friends get the best care they deserve. Now that your cat is recovering, how can you prevent future UTIs? Prevention is the key, and it's something that we can manage quite effectively. Firstly, let's talk about the litter box. It's our cat's personal space, its little bathroom corner, if you will. It must be kept clean at all times. Not only will this discourage your cat from urinating elsewhere, but it also prevents the spread of bacteria that could lead to infections. So make sure to remove waste daily and give the entire box a thorough clean at least once a week. Next, let's move on to the subject of water. Cats, like humans, need fresh water to keep their bodies functioning optimally. But did you know that water also plays a crucial role in preventing UTIs? It helps to keep the urinary tract clean by flushing out bacteria. Encourage your cat to drink more water by always providing fresh, clean water. Some cats prefer running water, so you might want to consider a cat water fountain. Now let's not forget the role of diet in preventing UTIs. High-quality, balanced cat food can promote urinary health. Wet food is particularly good as it provides extra hydration. However, it's always best to consult with your vet before making any significant changes to your cat's diet. And speaking of vets, regular vet checkups are a must. These visits allow the vet to identify and address any potential issues early on, including those that could lead to a UTI. Remember, your vet is your partner in keeping your cat healthy. Lastly, if your cat is prone to UTIs, your vet might recommend some specific preventive measures like urinary health supplements or special diets. It's important to follow their advice closely. In conclusion, prevention of feline UTIs involves maintaining a clean litter box, providing fresh water, offering a balanced diet, and regular vet checkups. It requires some effort, but it's all worth it when you see your cat happy and healthy. Remember, prevention is always better than cure. So to summarize the steps to take when your cat has a UTI, first, be alert to symptoms such as frequent urination or discomfort. Next, consult your vet promptly for a proper diagnosis. They're the best source of advice for your feline's health. Then, follow the prescribed home care routine, which may include medication and dietary changes. Lastly, focus on prevention through maintaining hydration and a balanced diet. With careful attention and timely action, your cat will be back to its playful self in no time. Thank you for joining us today, and remember to take good care of your feline friends.